Hello, I'm Dr. Bill Waggoner. Welcome to this week's Tuesday Tip. Depending on what state you practice in, you may be celebrating your one-year anniversary of reopening your office after the COVID closures. So congratulations. This time last year, it seemed like we knew so little about COVID and its transmissibility. In spite of having years of very good infection control practices, most of us realized that we had to take everything up a few notches. Of course, this included N95 masks, double masking, and it may have also included air filtration units, gowning, surgical caps, and even fogging our offices. Regardless of whatever else we did, I think 100% of dentists began using screening questionnaires to ask patients about COVID signs and symptoms and recent exposures. And many of us included temperature taking as part of our screening. I know at all three of our offices we have taken temperatures on every patient for the last year, and we have never picked up a single person that had to be turned away because they had a fever that day. At this point, we're continuing to take temperatures, but I'm not sure for how much longer. With everyone now so aware of signs and symptoms of COVID, I doubt that many people would purposely go places electively if they weren't feeling well. Actually, it's been the asymptomatic patients, particularly adults, that cause the greatest COVID concern. According to some of the modeling data from the CDC, nearly 60% of all transmission of COVID is caused by pre-symptomatic patients who haven't yet developed symptoms and by asymptomatic people who never developed symptoms. 20% of COVID-positive people never develop symptoms, according to some recent reports. All of this is an introduction to me sharing an article about pediatric COVID dental patients that was published this month in the Journal of the American Dental Association. The title of the article was Severe Acute Respiratory Syndrome Coronavirus 2 Infection and Asymptomatic Pediatric Dental Patients. It was authored by Lamborghini, Trifon, and Testi. The study was carried out in Chicago from April 1st, 2020 until August 1st, 2020. What the authors reported was an investigation of the positivity rate of SARS-CoV-2 infection in asymptomatic pediatric dental patients. This study was done as a chart review of dental patients seen for either general anesthesia or aerosol-producing procedures in the Pediatric Dental Clinic of the University of Illinois at Chicago. All of the patients were first screened with a typical COVID screening questionnaire. If they had positive responses to the screening questions, they were not seen in the clinic, but they were referred to their primary care physician. However, all of those who answered negatively to the screening questions had PCR testing done with a nasal swab to clear the child for dental treatment. The authors extracted demographic data from the patient charts and ran statistical analysis on it. In the 3-month period studied, there were 921 pediatric patients negatively screened and PCR tested. The median age was 6 years, and the range was 2 to 18 years. There were almost equal numbers of males and females, and the ethnic makeup of the cohort was 63% Hispanic, 16% white, 8% black, 6% Asian, and 7% other. The overall SARS-CoV-2 positivity rate of asymptomatic children was 2.3%. The ages of those testing positive with a median age of 7 years was not statistically different from those who tested negative. The positivity rates were statistically higher for the Hispanic group than the other groups. The frequency was 3.1% in the Hispanic group, 1.4% in the white group, and 0% of the blacks and Asians. Boys were more frequently positive than girls, but not statistically so. So what does all of this mean for us? Well, to be honest, I'm not completely sure. We're at a place in April of 2021 that most healthcare workers who want the vaccine have received it, and schools in many parts of the country are open and have not experienced any super spreader events, indicating that COVID in children does not seem to manifest the same way as it does in adults. Also, it appears that there have been few, if any, incidences of COVID infections traced back to dental offices in the past year. But that may be a result of our own vigilance and increased awareness. So I think that the data from this study depends on how you as an individual look at it. Throughout this entire year, some people have been very COVID cautious, while others have been more COVID casual. Some will look at this data and say, oh my gosh, 2% of completely asymptomatic kids that I was going to treat would have tested positive for COVID. While others will look at the same data and see a very small number that doesn't seem to alarm them at all. As dentists, we've done an apparently great job mitigating risk to ourselves, to our patients, and our staff. So personally, I would suggest continued prudence as the best course for now. But we also have to remember that everything we do each day comes with some small amount of risk. Hey, thanks for listening. Stay safe, and I'll see you next week.